Good afternoon or evening, and welcome. Kensington Senior Living has 8 unique communities, 5 located in Virginia, Maryland, and New York, and 3 sister communities located in California. Kensington is truly privileged to support care partners and professionals from coast to coast. Kensington focuses on relationship-based care, care built on the foundation of our promise to love and care for your family as we do our own. It is programs such as the one you are attending now that are so important for those of us walking through a caregiving journey to hear from expert professionals on keeping us current with the latest advances in care, management, and treatment of conditions that affect seniors and our families. I was first introduced to Kensington over 10 years ago as my father was a resident there for over 7 years. Everyone that registered for today's event will receive a copy to share with friends and families. Please also know to utilize the Q&A function to submit questions today for our doctor. Today is for you. Please use the opportunity to ask questions. Please join me in welcoming Dr. Ari Martinez. Her work and her support of the community, combined with her knowledge and passion, continues to impress me. Thank you for joining us. And could you please share with the audience a few words about yourself, Ari?
Absolutely. And it is a pleasure to be here today. Thank you for the invitation. So, I'm a genetic counselor. I think a lot of people tend to associate genetic counseling with couples, planning a family. But genetic counselors we're sort of like translators of genetic information that can sometimes be very complex for some people. We're not very used to it. And, to try to translate it in terms that people can understand it and how it can have an impact. So I've been a genetic counselor for over 20 years. I've worked in different areas in genetics. And currently, I work in the UCLA Eastern Center for Research and Care, where we do, just like the name says, a lot of research, a lot of cutting edge research on dementia, as well as we have a memory clinic where we see our patients. And I meet with patients there, either individuals who are at increased risk or who have been diagnosed. And I also do research myself in the areas of dementia. Um, I am a certified genetic counselor, which means I have to go through specific um, trainings throughout my career, just like a physician would. And because it is important, especially in genetics, it changes so much and so rapidly to stay on top of things.
I
So
have a
yeah,
question. I
yep.
actually have a question, my mind is just spinning. So you've been doing this for over 20 years. Can you
Mhm.
just give us a little insight into, we talk about change and all this, and we're learning so much more about genetics. What have you seen as just rapid change in the last 20 years? Like what excites you and what scares you?
I think I guess what excites me is how much we have learned in these years, how many new genes we have identified, how many, how our technology has allowed us to look at a person's genes much more quickly and a lot less expensive than it used to be. Before, it used to be, you could have your whole genome sequence for $1 million. Now that's closer to $1,000. So it's become more accessible. But I think we're also learning the connection between genetics and the environment and how not everything is genetic. Um, and but I think what it doesn't worry me, but I think in genetics, as with many other things, sometimes it feels like the more you learn, more doors are there to open. So yes, we've opened many doors, but each one of those doors is like, oh, okay, now we're here. Now what do we know about this? And so we're still, even though we've advanced tremendously, there's still a lot that we need to understand.
It reminds me a little bit when I was a little girl and you'd see a falling star, a shooting star. And then my dad would say to me, that probably happened millions of years ago. It's like genetics, just like the universe. It seems like it's so vast
Hmm.
and we're really learning a lot, but there's so much more to learn. So
Absolutely.
for the audience today, I really encourage you to utilize the Q&A function. I think we all have questions. I certainly do about our genetics and what does that mean for us? What does that mean for our offspring? How do we navigate this information that we have and how can we utilize it? But I'm going to start with one discussion piece that Ari and I were talking about a few weeks ago. And that was, I want the audience to think about this is different ways to think about genetics, benefits, limitations, risks on genetic testing, right? And what we can control, and this is what you had said to me a few weeks ago, what we can control. There's certain things we can control, but there's certain things we cannot control. So I think that will really spark a lot of good conversation today.
Hmm.
I can't thank you enough for being here. Audience, you're in for a treat. Ari is going to do a presentation, and once again, you will receive a copy of this webinar because I always get tons in the Q&A. Could you repeat that? Can you show that again? But you will all receive a copy of this to share with friends and family. And again, I'll be back after your presentation, but thank you so much for being with us today.
Absolutely. Thank you very much.
Enjoy.
So I'm going to share my screen. Okay, so you should be seeing my first slide. And I think it is important to think about. I know we have, a diverse group of people in attendance. And some of you may be wondering, why is this important for me to know? Why should I know about genetics? Why should I care about genetics? And um, I think there are two, ways to think about it. One is that we are all at risk or at an increased risk to develop dementia during our lifetime. And as we will talk about, genetics plays a role in that risk. And then the second thing is that there's a lot of information in the news that has started to come out about dementia, about the ApoE gene, about, CRISPR or different things about, genetics that it's important, that we all try to be on the same page. We, even if a cure may not necessarily be there, maybe if not all of it applies, I think it's very important that as a whole, we try to have start from a level of knowledge that allows us to understand that information when we hear about it in social media or in the news or from friends in different places. So the topic again, like today, is genetics, understanding our genetic risk for dementia. And so for some reason, this went to the last slide. Okay, I'm going to ask you to close your eyes. I'm going to go back really quickly. Okay, here we go. Hopefully this will take me just to the next slide. It does. So as a refresher for everyone, again, because I think we have a wide audience, what is dementia? So I think the important thing to remember is that dementia is not a normal part of aging, right? So normal part of aging would be on occasion we forget where we park, where we put our keys, we forget someone's name, but it happens occasionally and it doesn't impact our daily life. But when there are changes in our language, in our thinking, in our memory, our judgment, our reasoning, in a way that does impact our daily activities of life, that's when we call it dementia. And it could be, just being able to take our medications, being able to cook for ourselves, driving, taking care of bills, taking care of ourselves. And dementia, as you probably have heard many times, and you may have seen this in different ways, is an umbrella term that describes all those changes that I mentioned before that happen in our brain. Um, and there are different forms of dementia. So, Alzheimer's disease is a form of dementia, frontotemporal dementia, vascular dementia, Lewy body dementia. Those are all different forms of dementia. The most common one is Alzheimer's disease. So the vast majority of cases. And, a lot of us are wondering, well, we are all at risk. What are some of those risk factors? So, things that contribute to a risk for dementia include our age. Age is probably our biggest risk factor, our genes, our family history, medical conditions such as diabetes, high blood pressure, high cholesterol, brain injuries, as well as environmental factors. And you may notice that the ones on the three on the left are colored different from the three on the right. And that's because those on the left are factors that we cannot control, right? We cannot control our age, our genes, our family history. Whereas on the other side, there are factors that we could potentially be able to control or change. And I like to bring this up at the beginning because I think it's important to try to remember this as much as we can. There are things we can't control, there are things that we cannot control. Um, and it's important and sometimes can be helpful to just focus on those that we may be able to control, right? So how can we, control some of these risk factors? By a lot of the things that we already know, and many of us are probably already doing. So having a healthy diet, trying to do physical exercise or just activities doesn't mean having to go to the gym, but just having an active lifestyle. Making sure that we try to prevent medical conditions, or if a medical condition does develop, that we keep it under control. It's very important to stay socially active and keep our mind and our brain active, such as by reading or learning a new language or going to a museum, talking to friends. All of that can help reduce our risk. It's actually estimated that about 40% of our risk for dementia may be modifiable, meaning we may be able to change it. So I think that's very good news. That some of it we may be able to do something about. Now, I think it's also important to learn about those factors that we are not able to control. And so today we're going to focus on specifically our genes. So some of you may be very familiar with genes. For some, this may be new information, and that's okay. So our genes are like the instructions that our body has that tells our body how to develop, how to grow, how to function, how our heart functions and our brain. And as humans, we share 99.9% of our DNA. So 99% of our DNA, we all have the same. But we all have very small genetic differences, and those genetic differences are what make us unique, right? So different color hair, different color skin, different height, different body posture. Some of us may be more athletic than others. A lot of that is coming from our genes and small differences in those genes. Now, what is the connection between genes and our health? So, genetic difference in some genes can increase the risk of some medical conditions, such as inherited forms of cancer or inherited forms of heart disease, as well as some forms of dementia. Okay. Our DNA or our genetic information in our DNA uses a specific language that you may have seen includes these four letters T, C, G, and A. When there's like a long strip of DNA, our body can only read three of those letters at a time. And that's important because when there is an error, the recipe or the instructions change. So I'm going to show you an example that it's not DNA, but may help understand this. So imagine we have a sentence that says, add one big egg. And those are all three-letter words. The normal recipe is that line. But what if there was an error and the first letter was missing? All the other letters now shift, and that recipe, that instruction no longer makes sense. The same, maybe we have the A, but we added an extra D on the second word. So starting there, everything is going to be shifting due to this extra letter. And again, the instructions are not the same. Another example, sometimes you can have a different letter. So instead of saying add one big egg, you have add one bug egg. So if you were to follow the instructions, those would be, that would be a very different recipe that you would be making. And so um, these are some of the things that are happening, or the differences that I mentioned before that can be related to certain forms of inherited conditions, including dementia. So let's take one step back and talk about risk factors. So, in general, I think for probably all health conditions, there are different risk factors. There are some factors with the blue circle that protect us from that particular condition. There are other factors that maybe are neutral. Maybe they don't increase or decrease our risk. And then on the left-hand side, we have the brown circle representing factors that increase our risk. And so on the left-hand side, we have if the majority of factors are protective, even if we have some increasing risk factors, that person is have a lower risk to develop that particular condition. On the other hand, if we have more risk factors and less protective factors, then that individual is at a higher risk to develop a particular condition. Okay. So you may be wondering, so what are the genes that are related to dementia? So it's helpful to think of them in two ways. We have one type of genes where a single genetic difference, also called a mutation, occurs. This is similar to the first two examples that I showed where the letters shift. That recipe no longer makes sense. And so that the instructions don't work, that gene doesn't work, and that is enough to cause dementia. Just a single genetic change, again, that we typically call a mutation or an error in that gene, is sufficient. On the other hand, there are what we call risk-related genes. So these are genes that maybe have a difference, like the bug, maybe, so the recipe is, most of it is there. There may be a slight change. And it happens in many genes. So not just one gene, but you need to have it in many genes to have an increased risk for dementia. So let's talk about the first type, the types of dementia that are due to a mutation in a single gene. So one important thing to remember is that these are very, very rare. So if you gather 100 people that have dementia, maybe about one of them will have a mutation, a dementia related to a mutation in a single gene. Most of the time, of this type of dementia happens. Symptoms start very early, before the age of 65, and some people could be in their 40s and their 50s. And we have made advances, and we have, scientists have identified many genes, but there's still many that we still do not know yet. Some examples of this type of dementia that are due to a single genetic error would be some forms of frontotemporal dementia, as well as early onset Alzheimer's disease. So again, for this type of these types of errors in our DNA, it's helpful to understand how they are inherited, right? So that we know the risk for our family members. So for every gene that we have, we actually have two copies. In this example, the DNA molecule on the left has a mutation marked by that X, and the other copy of the gene does not have a mutation. To our children, we pass one or the other. And typically, we cannot choose which type we pass on to our child. So there's a 50% chance of passing on the one that has a mutation and a 50% chance of passing the one that does not have it. So imagine in this family, you have this grandmother at the top who has frontotemporal dementia that is due to a genetic mutation. That grandmother has a 50% chance of passing it on to her son, right? So the son has a 1 in 2 or 50% chance of inheriting that, the one with a mutation. And then if he does inherit it, each one of his children will also have a 50% chance of inheriting the mutation. So if a person has 5 children, it could be 5 and 5, it could be 3 and 7, it could be 6 and 4. Each child is like a toss of the coin and what gene is passed on. Again, in these types of dementias, a single genetic error or mutation can be sufficient to cause dementia. If a child, however, does not inherit the mutation, they are not going to pass it on. This is not something that skips generations. Okay. And you can see at the bottom, so this single error, this mutation can increase the risk of a person to develop dementia to up to 90 to 100%. So it really increases the risk significantly. The way that I think about it is, again, looking at our risk factors, if in this, a mutation is equivalent to having potentially many, many risk factors clumped into one. And so that even if you have some protective factors, that's not going to be sufficient. The weight of that mutation is enough that it tilts the balance towards a person being at high risk and developing the condition. What is exciting is that we're starting to learn about some genes that are called modifier genes. So these are genes that we have found that they may nullify the risk of that mutation. So that even if someone has a mutation that, most typically would cause disease, some individuals have these modifier genes that actually may protect against that mutation, and that person may not develop that condition and never be diagnosed. We are still learning about modifier genes. We've learned them in a few genes. So many genes, we have not identified any modifier genes, but for a couple there are. We're still studying, and for the most part, they're not available yet for genetic testing. So now let's go back to the other set of genes, the genes where a person needs to have many genetic changes to develop this form of dementia. So actually, this is the most common form of dementia, is due to several genetic risk factors. Usually this happens later in life, so most commonly after the age of 65. The same, we know many, but not all the genes that may increase our risk for Alzheimer's disease, for example, have been identified. And actually, we have found that there are some of these, the same gene may have some forms of it that may protect against dementia and some forms that may increase our risk for dementia. So the gene by itself is not what causes the risk, is what version of that gene a person has. And examples of this would be late onset Alzheimer's disease. So for most dementia, and I think this is something important to remember, for most cases of dementia, it are related to many genetic and non-genetic factors. So we talked about these genetic factors, some may be protective, some may increase the risk. By themselves, they do not cause dementia. It's really depending on what a person has. Maybe a person has many, a person may have few. But in addition, what is going to be important are non-genetic risk factors. So, like we mentioned before, our diet, our health, our family history, our lifestyle. Those in combination with those genetic factors are what contribute to the risk for dementia. By themselves, it's important to remember that they are not enough to cause dementia, those genetic risk factors. It's really a combination. So you may have heard about the ApoE gene. This is a gene that is very important for our heart and our brain health. So it's important that we have the gene, but it does come in most frequently three different versions, what we call ApoE4, ApoE3 in yellow in the middle, and ApoE2 on the left-hand side. The right-hand side, sorry, in blue. ApoE4, from what the studies that have been done, increases a person's risk to develop Alzheimer's disease specifically. The E3 version of this gene doesn't really increase or decrease the risk, whereas the E2 version may be protective and may lower our risk for Alzheimer's disease. The E3 form is vastly the most common form of ApoE, followed by E4, and then the rarest form is E2. It's very pretty rare. And we all have two copies of this ApoE gene. We inherit one from each of our parents. And so these are some possible combinations of ApoE genes that a person may have. So ApoE by itself, learning our information, does not predict or cannot predict who will develop Alzheimer's disease. So let's first take a look at the diagram on the left. Here we have a person maybe that has two ApoE4s. Maybe in addition, they are elderly. Maybe they do not have very good heart health. So even though they've exercised and they may have other protective factors, if they're not enough, that the seesaw is going to tilt, or the balance is going to tilt towards the risk, and that person will likely develop Alzheimer's disease. On the other hand, on the right-hand side, you may have a person that also has two ApoE4s. Maybe they're also elderly. But if in addition they have, a healthy lifestyle, they're in good health, they do exercise, maybe they have some protective, other genetic risk factors that we may or may not know about, that individual may never develop and may never be diagnosed with Alzheimer's disease. So while E4 increases the risk, by itself, it's not going to be enough to cause Alzheimer's disease. Again, it's that balance, right, between protective factors and risk factors. Maybe now let's look at a different situation. Maybe in this individual, they have two E3s. E3s, as you may remember, doesn't increase or decrease the risk, so that's why it's in the middle. If the individual, for example, on the left has, is elderly, maybe has some genetic risk factors, but on the other hand, they have a lot of protective factors, they may never develop Alzheimer's disease, and the risk may be tilting towards those protective factors. On the other hand, on the right-hand side, you may have someone who has the same two E3s. So they shouldn't increase or decrease their risk. But if that individual is in poor health, maybe doesn't have a healthy lifestyle, maybe has in addition some genetic risk factors, even if they do exercise and maybe if they read and they do other things, they may have, the balance is going to tilt towards the risk, the increased risk. Okay. And so the E4 is not necessary to have Alzheimer's disease. Even individuals who do not have an ApoE4 can still develop Alzheimer's disease, again, because it all is going to come down to many genes and many non-genetic risk factors and the combination that each one of us have. A lot of times people ask, so what is my risk? And I think these diagrams can help us understand how difficult it is to assess someone's risk, because they're not just based on one specific gene, it's many genes, but also, our risk factors, our lifestyle, and some of them can be modified. And so I think, again, bringing up, there are some of these factors that we are not going to be able to control. We're not going to be able to change. And so there's really no need in focusing on those because there's not much we can do. But sometimes it can be helpful to focus on the ones where we may be able to have an impact. So some people want to know, well, can I have a genetic test to try to find out, you know, whether I have this single gene type of dementia or the one that has many genetic and many non-genetic risk factors. So genetic testing is available. Um, for those who may never have had a genetic test or are not familiar with this, this is typically done through a saliva sample and a blood sample. And basically, what we do is um, the, the genetic testing lab will extract the DNA and will look at under specialized machines to see whether or not we have inherited one of those changes that I mentioned before. Do we have an extra letter in our DNA, one that's missing, one that is changed? Maybe we're missing large portions of our DNA, etc. Regardless of the genetic test that a person is having, it's really important to think about what are the benefits of undergoing that genetic test. Also, what are the potential risks? And also, what are the potential limitations? And once a person has all of that information, then they can decide, is this a good option for me or not? So I'll talk about the risks first because again, it is really involved, any type of genetic test. I think one thing to think about is what is the emotional impact, right? So some people, if they undergo some form of genetic test that doesn't say that they have, an increased risk, they may feel, relieved and happy that information. Whereas other individuals, if they learn that they do have a genetic risk factor, for example, they may feel sad, they may feel worried, for themselves, for their family members. Other people really, are okay either way. Family relationships can also be impacted. And why is that? Well, because we share 50% of our DNA with our children, with our parents, and with our siblings. And so sometimes when we have genetic testing and we learn our genetic information, that information may also reveal information about our family members. And some of them may want to know that information. Some people may not want to know that information. Okay. Some people are also concerned about the potential for genetic discrimination. So currently, there is a federal law called GINA that will hopefully stay in place. And what GINA does is prevents discrimination in health insurance and most employments in regards to genetic information. So based on, person's family history, or if they have underwent a genetic test, that information cannot be used to deny a person's, again, health insurance or employment. However, GINA does not protect against discrimination in other forms of employment, or I'm sorry, in other forms of insurance, such as disability insurance, long-term insurance, life insurance. None of those are protected. And so sometimes before, if a person is interested in undergoing genetic testing, but they're concerned about potential genetic discrimination, what some people do is they get those types of insurance and then they undergo genetic testing. Because once you have that information, you do have to share it with your insurance company or at the time that you apply. There can also be misunderstanding of results and their impact. You're probably familiar with, companies that offer genetic testing without the need of a physician or a genetic counselor. So these are called direct to consumer tests. And I think, one of the drawbacks of these types of tests is that there isn't that discussion about what are the benefits? What are the risks? What are the limitations? Why should I, what should I think about when undergoing this test? And if there isn't a person who has genetics expertise or they have a very good way of explaining the results, a person may misunderstand what their genetic information may mean, and they may understand that having a specific risk factor 100% means that they will develop dementia when that is not the case. So it's really important that this does not happen. And one of the ways that, to try to avoid this is by undergoing genetic testing in laboratories that are what they call CLIA approved. So CLIA is a set of requirements that genetic testing labs have to meet if that information is going to be used to make medical decisions. So it's just similar to when you have your blood drawn for, to measure your cholesterol or your glucose. You go to a laboratory that your doctor recommends, that sends you to. And that report or that information of your results, your doctor is able to use it, right? But laboratories that are not CLIA approved, um, that information cannot be used to make medical decisions. And the reason is that they don't have to follow those standards. And those standards include making sure that there's not a sample switch, right? Making sure that the people who are analyzing really have the expertise to understand the information, etc. Okay, so let's talk a little bit about ApoE. We mentioned it briefly earlier, but I just wanted to again, talk about, what information can it give us? What information does it not give us? So again, what this test is going to tell us is what are the two copies of ApoE we have, right? Do we have two ApoE4s, two E3s, one E4, one E3? And based on that, we can learn what is our risk based specifically on ApoE only, right? So what is our risk for Alzheimer's disease based on our ApoE results? It can also help with to determine whether a person has an increased risk for some of the anti-amyloid therapies that are starting to come out because some forms of ApoE increase the risk for side effects. But ApoE genetic test cannot predict if someone will develop Alzheimer's disease. And that's something that is really important to remember. And there are currently no medications that will directly change that risk related specifically to ApoE. We cannot change the ApoE right now. We cannot block the ApoE right now. Okay. The health and lifestyle recommendations that we make to individuals who undergo genetic testing for ApoE are really the same regardless of a person's ApoE results. And again, the reason is that ApoE is one of those genetic risk factors, but there are others. And a person may have protective risk factors. They may have additional risk factors, right? But there are also non-genetic risk factors that need to be taken into consideration. Typically, for this reason, ApoE genetic testing is not recommended in individuals who do not have any dementia symptoms. Because at this point, there are no medical recommendations that would be given that would be different. Everyone should, make sure that they control any medical conditions that they have. Everyone should try to have, as best as they can, a healthy diet and do exercise. Again, because there are many risk factors. Okay. Now, for those individuals who are thinking about, maybe there is a hereditary form of dementia in their family. So due to a single mutation, or they're wondering if that's the case in their family. So the potential benefits of having this type of genetic test, one is it can potentially identify a cause, right? Maybe it can tell us why it happened. And a lot of times, even if there is no cure, no medication, just knowing why it happened can be very helpful. It can also help assess the risk of our relatives to develop something similar. Basically, did they inherit the same genetic change that another family member has? It can help with to determine eligibility into clinical trials. And if you're interested in learning about what clinical trials may be available, I recommend going to this website called clinicaltrials.gov, and you can type, a specific gene or a specific form of dementia, and you'll get a list of studies, some that may be recruiting, some that may be active but stop recruiting, and some that are already closed. But that gives you an idea of what is out there, what are researchers also looking into in regards to genetics. And then, the answers can also, a genetic result may also be able to help with medical management. Now, what are the limitations of genetic testing? So, um, on the left-hand side, we see there are limitations to our technology. We have made tremendous steps in making that technology much more efficient so we can get results much, much quicker. We can analyze larger parts of our DNA. But again, we still do not know many of the genetic explanations or genetic contributors. So this is an example in the middle of individuals with Alzheimer's disease. So in blue would be individuals who develop Alzheimer's disease later in life, after the age of 65, where most likely the dementia is related to many small genetic changes, right? And many non-genetic factors. And then the ones in yellow, and also including the ones in red, are individuals who develop Alzheimer's disease early. So they have the early onset form of Alzheimer's disease. As you can see, it's pretty rare. And of those are the ones for which we have identified single genes that may be responsible for those forms of early onset Alzheimer's disease. But when we test those individuals, only a small portion, which are in red, are the ones for whom we actually identify a genetic change. So a person may have early onset Alzheimer's disease. They may even have, several generations of individuals with early onset Alzheimer's disease. And when they undergo genetic testing, often we still do not find that genetic explanation, only in very few. So there's still more that we need to do, And the same, we're still also learning about the non-genetic causes. And how can we, potentially modify those to try to reduce the risk. So even in people who undergo genetic testing for a specific gene, let's say, there is a family history of frontotemporal dementia, and let's say a mutation is found, and family members want to know whether they inherited or not. Those family members need to know that all this test is telling us this genetic change is there or is not there, but it's not going to tell us when the person will develop symptoms, what type of symptoms they will develop, and the progression. Will it progress faster or slower? So again, those are things, those limitations are important to think in mind. Because of these limitations in our knowledge and in our technology, even if, like in that family that I mentioned, if we don't find a genetic explanation, we don't find a mutation, it doesn't rule out that there is a genetic component, right? It may just be that it's one of those people in yellow where we still do not know what the genetic cause may be. So when someone is considering undergoing genetic testing, it's very important to meet with a healthcare provider. Could be a genetic counselor like myself, could be a geneticist, or could be a physician who just has a lot of genetics expertise to help assess, first of all, is this genetic test would be helpful for me, or even what genetic test could potentially be helpful for me or for my family. And this is going to be based on, mainly in individuals who do not have any symptoms or family history. And individuals who do have symptoms, the same, their family history, but also, their specific symptoms. And if appropriate, and genetic counselors work with the insurance companies to try to get that, specific test covered, or they can help find programs that genetic testing laboratories offer for patient assistance, patient financial assistance. Um, this healthcare provider is going to discuss the benefits that we, went over today, the limitations and the risks, as well as the likelihood of finding a genetic explanation. They're also going to ask, who should we test in the family? In genetics, we cannot just test anyone in the family. We want to try to get to start with the person who's going to give us the most information that's going to be the most useful for the family, and obviously review the test results and the meaning of those results. But it's important to remember genetic testing is an individual choice. There is no right and there's no wrong decision. It's just what makes sense for that particular person. So you may be wondering, what can I do? I think it's very important to try to share our family medical history with our family members. Our family history can help our providers know what risk factors we may have. And therefore, once we learn about that medical history, it's important to share that with our providers. Depending on the history and our concerns, they may refer us to a genetic specialist. And it's important to work with those medical providers to try to have those, medical conditions under control. And it's important for us to aim to have an active and healthy lifestyle. And I say aim because we all try, right? But there are all sorts of barriers sometimes that can come up. But as long as we try, that's what we can do. So have a healthy diet, exercise, keep our mind active. And if at any point a person has any concerning symptoms, changes in their memory, their language, any of the things that we mentioned, please tell your provider. And you can ask them, to do a memory assessment, for example. And depending on the outcome, then your doctor may refer you to a memory specialist. Okay, so the take-home messages for today. So one, I think it's very important that we remember most cases of dementia are due to many genetic and many non-genetic factors, right? So an example would be ApoE testing, or ApoE is one of those genetic risk factors. And ApoE genetic testing is available, but all it can do is inform us or give us an estimate of our risk, but it does not predict who will develop or not Alzheimer's disease. Genetic testing for rare forms of dementia, that are due to a single mutation, is available. But it's important to think about whenever undergoing genetic testing, what are the benefits, what are the risks, what are the limitations? And ideally, everyone who undergoes genetic testing through have a discussion about this process with a genetics professional. Again, genetic testing is an individual choice. And while we cannot change our genes, we may be able to change our health, our environment, or in our lifestyle. And I think it's important to try to keep that always in mind so that we can focus on those things that we can potentially change and not on the ones that we can't. Okay, so that's all the information that I had for you for today.
I am absolutely blown away at what you do with all those little teeny things. I'm just joking, but it's amazing to me. So I am really intrigued, and I learned so much today that Alzheimer's disease, one is mutation, which means it's early onset or you have a mutation in your gene. And
Mhm.
so you can still encourage those lifestyle protective factors. But what is your chances of developing that if I'm 50 and I go in because my father had early onset Alzheimer's and I do that and I have this mutation, what are my chances of developing that?
So the chances can be, between, I would say, maybe 85 to 100%,
So, next
depending
question.
on the gene.
Yeah,
Hmm.
because it's a mutation, right?
Right,
So
right.
you're talking about modifier genes to go in and say, you've got this mutation, we're going to go in and tweak it and fix
Hmm.
it. What is the timing? That's fascinating. What's the
So,
timing?
so the modifier genes are already present in our body. So you may see, like in some families, maybe there are several family members that have dementia, but some develop it maybe in their 80s, some develop it in their 50s, some develop in their 60s. Maybe, we're thinking maybe those modifiers are protecting that person who developed it later in life. In some forms of even early onset Alzheimer's disease, even if a person has a mutation, like I said, maybe about 90% of them will develop it. That means 10% will not. Why is that? And that's where we think there may be some modifier genes that are playing a role, that are protecting that person, even if they have that, that strong mutation, they may somehow prevent that mutation from taking over the risk. Does that make more sense?
Fascinating. So,
Mm-hmm.
in other words, your body is protecting you without you even knowing it and
Exactly.
modifying that mutation because they're trying to fix it. So you
Mm-hmm.
got to unlock the key of why is that happening in some people and not others.
Exactly. And maybe in the future, not now, but maybe in the future, it could be used as a form of gene therapy, right? If you could, um, give a person that modifier gene, um, potentially, that could be helpful. But again, that is in the future. We first need to learn about those modifier genes.
That's fascinating. So let's say my dad has early onset, my mother doesn't, and I have. So what are my chances of getting that then? Is it still 50%?
If it's related to the mutate, if it does the one mutation, yes, you will have a 50% chance of inheriting that mutation from your father. And again, depending on the gene, your risk to actually developing the dementia is going to be between 90 and 100%. If it's delayed onset due to many genetic risk factors,
Hmm.
the risk is more difficult to assess,
Right,
right?
right, right,
Because now
right.
we have protective and non-protective
And you have
genes.
the
Mhm.
APO or maybe the AP2 and 3.
Exactly.
So, an interesting question just came in, and then I'll get to the other two that were in here. Could this modifier gene be inherited?
Yes. Hmm.
Those are
Yeah,
good
it's
genes.
just like we inherited, we can inherit mutations that are damaging. We can potentially inherit, beneficial protective genes.
And could you
And
inherit one from dad, the modifier, and the bad one from mom, and they work together?
you can even inherit them from the same parent.
Wow. Oh, this is just
Yeah.
like the galaxy we were talking about at the beginning. I'm just so
Yeah,
overwhelmed.
and this is pretty new. I'd say in the past few years that we've discovered, um, sometimes just by chance, by looking at a person's family history and saying, this is not making sense. This person should have developed dementia, but they didn't, or should have developed it much earlier and they didn't. And those are the cases where, after doing some research,
Yeah.
scientists identify, oh, there's this other gene that is being protective.
They got born with the golden egg. What
Mm-hmm.
about epigenetics? We had a question about epigenetics and just about the gut. There's a lot of conversation about these brain diseases
Yeah.
are in the gut.
So I think the epigenetics, I would say, are all those non-genetic risk factors, right? And it could be from, like we said, our diet. And our diet is not just, keeping our sugar low or our cholesterol low, but our diet also feeds our microbes, right? That live in our gut. And we're learning how important, our microbiome is. We still do not know exactly how to modify it, how to change it, exactly how does, do our microbes that live in our body um, may increase or decrease our risk. But, the thought right now is that, yes, having a healthy diet is going to help you keep healthy microbes that hopefully can help reduce our risk. But even in, in our digestion, we have genes that help
Right.
us digest better than others. Our genes are not just involved in our brain, but they're involved in our circulation, in our heart health, in our cholesterol levels, in our blood pressure, and all sorts of things. So if you think of any condition where you tend to see clusters, like sometimes you see cluster of people who have families that have high blood pressure, a cluster of families that have diabetes. There isn't a single gene that is responsible for it. It's probably a combination of many of those genetic risk factors that maybe, impact different parts of our body. So again, we cannot change, we don't know the exact recipe to change our microbiome specifically or the exact diet that someone has. That is still being researched, but what we can do is just we have a sense of what is a healthy diet.
Mm.
What does it mean to have a healthy lifestyle and be physically active and keep our mind engaged? We can leave all those details to the researchers and just take care of what we can do and know what we can do at this point.
And this is a whole other webinar that we'll do, but you mentioned in the beginning the environmental factors, and
Hmm.
that is obviously a contributor as well, the
Yeah,
plastics and air pollution and all
air
that.
pollution, but yeah, absolutely. All those things can play a role.
And now there's a question about GLP-1 and APOE4, and does it help? Any link?
My understanding was that there was a research study that was done relatively recent, and they did not find that. I think it was more with GLP-1 decreasing the risk for Alzheimer's disease, and they did not find that that was the case, at least for that initial study. Um, but I think, one study doesn't tell it all. There's probably going to be additional studies that are going to be done to look into it.
It's so new, right?
Mm-hmm. That's
Yeah.
so new, yeah.
And
But
then
but GLP decreases our risk for other things, right? It decreases our risk for heart disease, which is it's an important risk factor for Alzheimer's disease. So maybe indirectly it can
right,
help.
right, and sugar and all that stuff.
Mm-hmm.
Question, this is a great question from Diane, because my father actually passed away from Alzheimer's and my mother Parkinson's, so I'll be
Mm-hmm.
contacting you.
Mm-hmm.
But um, back in the day, they said that the only way that they could really diagnose my dad with Alzheimer's disease was autopsy after death. Is that still the same case?
So not anymore, and this is not necessarily available at every medical center. But now there are certain brain scans that can look for amyloid plaque, right, in the brain.
Mhm.
But something to keep in mind is that as we get older, we all develop amyloid plaque. That's part of our normal aging. Part of human aging is having amyloid plaque. So if a person does not have any symptoms and they have this imaging and they have plaque, the doctors don't know what to tell that person. Does that mean you have plaque because this is just at your age what you should be having? Or is it because you are starting to have signs of Alzheimer's disease? So all those, tests, even some of the biomarkers are better done in individuals who have symptoms. But though in those individuals who do not have symptoms, they're not as helpful.
Okay. And I did donate my brain to study at Stanford. He was being treated at Stanford, and
Hmm.
I just will make a little plug that any institution you're near, it's so helpful to help with that. But
Absolutely.
Ari,
Hmm.
thank you so much. This information. I mean, I've got so many questions. I'll have to call you later, but this has been so incredible, and I just can't thank the audience enough. I can't thank Kensington Senior Living enough. And thank you so much in UCLA and the Mary Easton Center. So
My
thank you
pleasure.
so much, and you
Thank
have a
you.
great week. Take
Sounds
care.
good. Take care.
Good
Take
night
care,
or good
everyone.
afternoon. Bye bye.
Bye bye.